So next, I want to talk about psychodrama as an effective treatment for trauma and PTSD. So remember, psychodrama was developed as a group psychotherapy. Psychodrama is part of a triadic system: sociometry, psychodrama, and group psychotherapy. If you wanted to learn more about the basics of psychodrama, I encourage you to consider checking out the other videos on this channel. The previous video I just mentioned on chapter 2 of this book covers many of the basic theories, philosophies, and methodologies within psychodrama. I'm not going to go through all of that again in this video, although I will be talking about many of the classical psychodrama interventions in a little bit here. So the research on psychodrama as an effective treatment for PTSD continues to grow, showing that it's a promising treatment, a promising modality for treating PTSD and trauma-related issues. There's a bunch of different research studies about psychodrama's effectiveness for treating PTSD and trauma with different populations, including military veterans, folks in inpatient substance use disorder treatment, mass shooting survivors, children who survived natural disasters, victims of intimate partner violence, and other forms of trauma. Psychodrama is also included in the meta-analyses of other fields and categories, such as the creative arts therapies, the experiential psychotherapy meta-analyses, the body and movement-oriented intervention meta-analyses. And all three of the meta-analyses in these categories show impressive rates of effectiveness comparable to other PTSD treatments that are focused on CBT or prolonged exposure or talk therapy. So the creative arts therapies, experiential therapies, body movement-oriented therapies seem to be at least as effective as CBT and other trauma treatments that are considered the gold standard of PTSD treatment. There's just less research in these areas because they're harder to research. The majority of research on PTSD treatments has been done with cognitive behavioral approaches because they're easily manualized and replicated, whereas the experiential therapies, psychodrama, drama therapy, art therapy, music therapy, somatic psychotherapies, other experiential approaches are hard or impossible to manualize, which makes them more difficult to replicate, which is one of the barriers to doing larger scale research studies on their effectiveness. Some of the other trauma therapies tend to have higher dropout rates, especially the therapies that involve participants exposing themselves to triggers related to the trauma, like prolonged exposure or telling stories related to the trauma. Some of these therapies can have higher dropout rates and can feel intolerable to participants who might not be ready to retell the story, remember, or relive the story of their trauma. In my 2020 research study on trauma-focused psychodrama, one of the interesting qualitative findings that emerged was that participants in the study who participated in trauma-focused psychodrama, they found that trauma therapy could be fun through psychodrama. They found that it was tolerable and that they even enjoyed themselves and laughed quite often during the treatment. Here's some of the quotes from some of the participants in my study. Participant said, "I always thought trauma groups had to be painful. I found that not to be truthful." Another person said, "I was able to release and let go of my trauma without reliving it." Another participant said, "I liked that it was also a fun experience." And someone else said, "Psychodrama was cool." So these quotes really highlight how psychodrama, even when focused on trauma, can be lots of fun and can be a tolerable alternative treatment to some other approaches that are commonly used to treat PTSD. Now, as the clinical research on the effectiveness of psychodrama for treating trauma continues to grow, the neuroscience research also continues to grow, and the neuroscience really supports psychodrama's effectiveness as perhaps a treatment of choice for treating trauma and PTSD. Moreno's the founder of psychodrama, he suggested nearly 100 years ago that the body remembers what the mind forgets. And this is echoed by trauma experts of today that really emphasize how trauma gets stored in the nervous system and in the body. Trauma impacts the body and the nervous system and parts of the brain below thinking, cognition, or even explicit memory. In some of the research on trauma and PTSD in neuroscience, they find that when we ask a trauma survivor to remember a traumatic memory and take a scan of the brain, that parts of the brain associated with language and speech appear to be completely offline. In particular, the Broca's area, which has to do with language and speech, seems to be offline when somebody's remembering a traumatic memory. And so this really challenges us as trauma therapists to reconsider some alternatives to talk therapy. If the part of the brain associated with language and speech is offline when trauma is activated, it means we have to use alternatives, movement, body, symbolic representation to help our clients tap into and express how they've been impacted by the trauma. Psychodrama's emphasis on symbolic representation, body movement, action, relationships, and other right brain processes positions it as an ideal trauma treatment in that it can access and renegotiate trauma in the places that it's stored in the mind, the body, and the brain. One of the most important neuroscience findings of the century is that the brain changes based on experience throughout the entire lifespan, not just until somebody's brain finishes developing when they're 23 or 25, but throughout their entire life. And so just like past experiences have an impact on our brain and its development, new corrective or positive experiences can also have an impact on the brain. So through the surplus reality of psychodrama, we can offer participants with experiences that might be impossible in real life, that might offer closure and a renegotiation on a neurobiological level of how the trauma from their past has impacted them and continues to impact them today. So I want to challenge you to reflect on a couple questions at this point. How can you incorporate body-oriented interventions into your work with trauma? And in what ways can you actively work to provide corrective emotional experiences for the clients that you serve? Whether that's through psychodrama or role-playing, or more implicitly through relationships and through the structures in your agency and groups.